Ivanka Trump's transformation may be one of the most expensive and fascinating evolutions in modern celebrity history. From her modeling days to her time in the White House, her face has changed dramatically. And the total estimated cost? About $400,000. But how is that possible? And which procedures could have added up to that staggering total? Today, as a double board certified facial plastic surgeon, I'll break it down year by year, from her early features to her most recent photos. By the end, you'll see how subtle shifts can completely redefine a person's face. In the year 2000, at the age of 19, you can see that Ivanka has equal horizontal thirds. She has a relatively flat eyebrow architecture. She has mild upper lid hooding with minimal upper tarsal show. Ivanka has strong mid-face and lower face bone structure. She also has a narrow nasal bridge and a narrow mid-vault. And there is mild nasal tip bulbosity. But her nose wasn't always like this. So when you compare Ivanka here at age 19 to her earlier teenage years, you can see the difference in her nose. The upper part and the middle part of the nose are definitely more narrow now, and she's lost that hump. Those types of changes don't usually occur naturally on their own, so I suspect a primary rhinoplasty around this time. And when it comes to Ivanka's lips, she naturally has full upper and lower lips. And you can see when she opens her mouth, she has some upper tooth show. In 2001, at the age of 20, I see no change. In 2002, at the age of 21, I wanted to highlight here that Ivanka has a M-shaped hairline. Even though her widow's peak is not too exaggerated, and her frontotemporal corners are not too deep. Contrast that with a more rounded hairline that other women have. There are various configurations, including this M-shaped and rounded types of hairlines that are very aesthetically pleasing in women. Again, looking at Ivanka's nose in these pictures, what I'm seeing is that the nasal tip appears less bulbous. That to me suggests that she may have had a revision rhinoplasty to have the upper and middle thirds be more in line with the nasal tip. Also, her chin here appears less recessed, so perhaps she had a chin implant to bring it forward and to complement her now more slender appearing nose. I also wanted to point out here that when Ivanka smiles, she has full upper tooth show. This is quite uncommon, but is a very beautiful trait. In 2003, at the age of 22, what we see here with Ivanka's lips is that the philtrum is quite short. Remember, the philtrum is that distance between the base of the nose and the Cupid's bow. And it's an area that people come to me sometimes looking to shorten. But in Ivanka's case, her philtrum is already quite short. Her philtral columns and Cupid's bow are not naturally very defined. And a common question that I get with my Ella Lift lip lift is that will it further define the philtral columns in Cupid's bow? And the answer is no, it won't. It just shortens the philtrum and elevates the upper lip, creating more arching to the upper lip, but it does not bring more definition to those anatomical areas. In 2004, at the age of 23, I see no change, and that's the same through 2011. In 2012, at the age of 31, what I see here is that Ivanka may have started to get some Botox to the common areas, including the forehead, the glabella, and the crow's feet. You can barely see any lines when she smiles, and at age 31, that's quite uncommon without the addition of neurotoxin. Even though some people start prejuvenation with Botox in their 20s, it's actually more common to initiate the use of Botox in the face when people are in their 30s and beyond. In 2013, at the age of 32, what I'm noticing here is that Ivanka has some slight right upper eyelid ptosis. And to my eye, this was present earlier, but it might be more pronounced now as the tissues are starting to slowly descend. But of course, Botox might be contributing here. We know that when we inject Botox too close to the upper eyelid, it's possible for the Botox to creep into the levator palpebrae superioris muscle. If that muscle gets affected, you can get a droopy eyelid, and it will then take months for return of function to the affected eyelid. A drop that's commonly given to combat the effects of this type of complication of Botox is aproclonidine. In 2014, at the age of 33, I see no change, and that's the same through 2016. In 2017, at the age of 36, we're starting to see some aging changes in Ivanka's face. For one, there's an increase in infraorbital hollowing, and the lower eyelid skin appears to be more crepey. I'm also noticing a deepening of her nasolabial folds. This occurs as the cheek starts to lose some of its support and it starts to descend down and in. That's also part of the reason why we get jowls that form and some increased submental laxity. Remember that the face and the neck are connected as one system, and they tend to fall together. At the age of 36, these are very subtle changes, and they're only starting to occur, and it's very difficult to perceive them unless you're looking at certain angles and you kind of know exactly what you're looking for. Otherwise, it's very difficult to tell, and she still looks extremely youthful. In 2018, at the age of 37, I see no change. In 2019, at the age of 38, I'm starting to see the introduction of possible cheek filler. Especially when we look at the three-quarter view, we can see more projection coming from the cheek area. Remember that for the cheeks, it's more common to use a higher G' type of filler that has a thicker consistency and is usually applied directly onto the bone. That's different from other areas where you're looking to go more into the soft tissues. For the cheek, especially as you get more lateral, you tend to go directly on bone for augmentation. Whether it's surgery or just gray genes, what stands out the most is how consistent her look management has been. It's usually not about trying to look different, it's about looking polished year after year. And for most people, that kind of maintenance can start with simple steps, like keeping your hair and scalp healthy, for example. And that's why I created Feel Confident, a doctor-led hair care line designed to help you keep your hair looking thicker and healthier as you age without any surgery. Our root defense thickening products are packed with clinically tested ingredients like pumpkin seed oil, saw palmetto, caffeine, and curcumin. They're backed by science and made to help you feel your best every day. You can learn more at feelconfident.com. In 2020, at the age of 39, I see no change. And in 2021, at the age of 40, I see no change. In 2022, at the age of 41, it looks like Ivanka may have had a brow lift and or upper blepharoplasty around this time. Her brows now look more elevated and there's more supratarsal show. Sometimes with brow lifts, you can just get the lateral or tail of the brow lifted through a temporal incision. Other times, the brow is lifted as a complete unit through several small port incisions that is usually performed with an endoscopic type of approach. I think Ivanka may have had an endoscopic approach with a full elevation of the brow rather than just the tail of the brow, just given the overall positioning of her brows at this stage. I also think that Ivanka may have started to get some lip filler around this time. You can see that there's some filler settling out outside of the vermilion border right around the Cupid's bow. It's a very common technique to inject filler into the vermilion border itself, but what often happens is migration and essentially like a spilling out of the filler from where you placed it into the surrounding tissues. So oftentimes when we place lip filler, we'll try to keep it to just the pink portion of the lip and not into the border itself to try to minimize that type of spread. I think it's also possible that Ivanka may have had a buccal fat removal. We can see the hollowing out of the cheeks, and I have some thoughts on the buccal fat removal surgery. So if you want to check that out, make sure to watch the video below. In 2023, at the age of 42, it looks like Ivanka may have continued making some adjustments to her face. For example, when I look at her cheeks and her jawline, it looks like there's more fullness there, but the fullness looks very orderly, and you can almost make out the shape of what lies beneath it. So, in my estimation, this may have been some implants. When we go back to her earlier years, where we discussed that potential revision rhinoplasty and the chin implant that she may have had around that time, perhaps they exchanged that chin implant that was just sitting right here at the medial kind of central part of the jawline for something that may have even been 3D printed to better match her lower face configuration and to extend further along the jawline, creating more angulation in the gonial angle and giving her more definition along the jawline. And maybe around that time, they decided to put some cheek implants as well for the balance of those two, for the upper jaw to match the lower jaw, for the mid face to better match the lower face. Now, could this just have been done with filler? Yeah, it's possible. But again, when you compare back to older pictures, to me, it's obvious that there has been a shape change beyond what I think filler can do, especially when we look at Ivanka back in like 2009 and we start to follow the jawline from the middle out to the side. There was a softer extension going posterior, and now there's a little bit more material there. And it's possible that along with these theorized implants, Ivanka may have had a facelift as well. And as I always do, I like to look at the tragal area because that's usually a giveaway for a facelift being done. And we'll look at that coming up next. In 2024, at the age of 43, I see no change. And in 2025, now at the age of 44, let's go over some of the main changes that I see compared to when, say, Ivanka was 27. Her brows look more elevated. The shape of her cheeks and jawline have changed. And back to what I was saying about facelift surgery, often impacting change around the tragal region. When I look here at Ivanka, it looks like she might be missing some lower sideburn hairs. And oftentimes when incisions are made around the ear, when the skin is brought up and back and some of that excess skin is removed for facelift surgery, some of the hair also gets removed. So it's not just the impact to the tragus that we often see where it tends to flatten out like a pancake and get a little bit larger. What we also see is a loss of hair in that region. And I discussed this more in my video on modern facelift surgery. If you haven't watched that yet, make sure to check it out. So when you take a step back and you look more like zoomed out, more holistically at Ivanka's face, some of the main changes that we're seeing is that her softer, rounder configuration to her face has now become more angular, right? So the shapes appear a little bit less smooth and round and a little bit more exaggerated, and I would say even a little bit more harsh and angular. And she still looks very beautiful, but things just look different. And to me, it's not just signs of the aging process that I'm seeing. And as I mentioned at the start of the video, the total estimated cost of these potential procedures is $400,000. So what do you think? Is Ivanka Trump's transformation purely natural evolution or the result of carefully chosen procedures? Let me know your thoughts in the comments below. And check out my video on the Mar-a-Lago phenomenon for more insight into how certain beauty trends take hold. I'm Dr. Gary Linkov. Thanks for watching. And as always, I want you to feel confident, whether with plastic surgery or without.